When you eat a peach, you should eat the seed. But did you know if you eat the seeds to the fruit, you get a vitamin you don't normally get otherwise? There's a group of folks in Pakistan called the Hunzas. The Hunza tribe up there in the mountains, the Himalayas, when they were first discovered, the average age of the Hunza was reported to be 160. The more contact they had with the outside world, the more their lifespans dropped. Today their average age is about 90. One of the favorite foods among the Hunza tribe is the apricot seeds. They treat them like money. They'll buy and sell things with apricot seeds. They take the apricot seeds and squeeze them and get the oil out. The women put it on their face and it prevents them from wrinkling. They say the women look great for years. Average age of 90, and they never get cancer. Well, that's interesting.
Hi, this is Angela Atkins of your Sovereign Sisters podcast. In the following episode, Dr. Jean Sambataro is joining us via his telephone. Unfortunately, the cleaning crew locked him out of his office and he couldn't get in, and so his Wi-Fi is unstable. And there are portions of this podcast that the sound will go in and out, and hopefully there will be a transcript that you'll be able to view on some of the channels that this is posted. I apologize in advance, but Dr. Jean is a wealth of information that I think you should really try to listen to and get the most that you can. And so I want to introduce you to Dr. Jean Sambataro. Welcome to Sovereign Sisters Podcast. I'm your host, Angela Atkins of Your Health Unbound. And today my special guest is someone who has redefined what it means to be a dentist. Dr. Jean Sambataro, known affectionately to his patients as Dr. Sam, is a pioneer in the field of biological dentistry. He's based in Ellicott City, Maryland, and he's dedicated his career to a more holistic, health-centered approach that challenges many of the assumptions behind conventional dental care. Dr. Sam isn't just filling cavities. He's filling in the gaps between oral health and total body wellness. His passion for biological dentistry is deeply personal and profoundly purposeful. After losing his father, Julian Sambataro, to a heart attack, an event that he believes was impacted by conventional dental treatments and undiagnosed sleep issues, Dr. Sam made it his mission to prevent similar tragedies. Through his practice in his healing center, named for in his father's honor, he works to educate patients about the dangers of mercury fillings, root canals, and untreated sleep apnea. He sees dentistry not just as oral care, but as a true preventative medicine grounded in the Hippocratic principle, first do no harm. Along his pioneering work in biological dentistry, Dr. Jean is also the author of Stop the Snore, Dental Solutions for Healthy Sleep. In it, he draws a bold and often overlooked connection between what's happening in our mouths and the quality of our sleep. He argues that snoring and sleep apnea aren't just nighttime nuisances, they're health alarms that demand real solutions, not just Band-Aids. Through practical insights and decades of clinical experience, Dr. Sam shows how dentists can step into a critical role helping patients reclaim healthy sleep, often with simple, non-invasive tools like oral appliances. It's not just about stopping the snore, it's about stopping the long-term damage poor sleep can cause. And I want to welcome Dr. Sam to Sovereign Sisters podcast.
Oh,
well, great
my
to
God,
have you here.
Angela. Yeah, thank you. I think the podcast is over. You did everything and said everything I need to say. That was a great
think
intro.
We can actually go much deeper.
Yes, we can. But I appreciate that. Giving that intro gives people an idea of where I'm coming from. This is not just on a whimsical move. I mean, it's been a long time to this passion and dedication, even before, as you mentioned, with my dad's heart attack and his sleep apnea issues. So it actually started even before that. So I graduated from dental school, University of Maryland, in 1980. Then I did a hospital residency for a year. And then I went into an associateship at a practice and then realized that something needs to be different. So I went off on myself and opened my own practice, but I was still doing what we were brainwashed to do, was placing mercury as the number one, say, gold standard for treating cavities, doing fluoride treatments. We can spend some time on that now that it's been brought to the attention of the country and the world, thanks to Robert Kennedy Jr. And just a little side that Utah and Florida now have banned it from the water supply, and the FDA just banned prescription fluoride for infants and children. So we're making some positive moves. So this, is so heartwarming to me because I've been fighting this battle for so long. But I'll go back to my beginning. It was about 6 years practicing traditional dentistry. That's what we were taught. I was an honors student at the dental school. I was the president of the Student Dental Association. So I was right on the right path to be the best dentist until I realized that when my friend, who we were close in both grade school, high school, we were also fraternity brothers in college, was diagnosed with a stage 4 melanoma about 1986. He was told he had 3 to 6 months to live. So before I tell the rest of the story, he's still alive today. So that tells you something about the medical system. He decided he was going to go into this place. I think, if my memory is correct, it's called the Livingston Wheeler. It was in San Diego, I believe. He went there, and then I think Mexico. And when he walked into the clinic, they said to open his mouth. And they looked at his mouth and said, you got to get rid of all that metal out of your mouth before we can start treatment, because the therapies we're going to recommend for you aren't going to be as successful if you're fighting this mercury toxicity. When he came back from that, he told me, I thought that was the craziest thing ever. You're talking about a paradigm shift. So I said to him, I need to do a little more research about this, because this is not what I was taught. So in how the universe works, and, God brings this information when we need it. Somehow I found this book. It was called It's All in Your Head by Dr. Hal Huggins, who was truly, you said I was a pioneer. He was the pioneer. He was the dentist that had all the arrows in his back. And so I called him up, and I remember this clearly, because this is like 1986, 87, reading his book. It was in a flight on a plane with my wife going, I don't remember where. And as I was reading it, my wife is also the dental hygienist in my practice. We've been working together for over 40 years and still married. So that's pretty incredible.
That's awesome. That's absolutely awesome.
She's awesome. So she's been a great inspiration. And I read this book and I said, oh my God, Cindy, I think we're poisoning our patients. She's like, what are you talking about? We're doing good dentistry. So I called Dr. Hal Huggins, who had a center in Colorado Springs, Colorado. And I called him up and said, Dr. Huggins, I've read your book. Can I come study with you? So I made several trips on many, many times studying with him, learning about the dangers of mercury. And then, of course, Angela, as you know, once you go down the rabbit hole, there's no turning back. So it was just the beginning of the journey. So then I learned about the dangers of fluoride and why we were being poisoned by having this stuff put into our water supply without our agreement to do that. So who asked me if you want to have fluoride? And of course, they said this was the greatest public health service. But the reality is, and not going too much into that, that can be another podcast just on fluoride, is if it really worked, dentists would be out of business. It doesn't work. And even if it has a slight benefit, the risk-benefit ratio just doesn't make sense, because fluoride will deposit in your skeletal system, so you can get skeletal fluorosis. It can cause enamel issues. So you have brown enamel. It now we know can calcify the pineal gland. They've shown studies where it actually decreases the IQ in children. So why are we putting this in? And then again, and then we'll get into this, if you want to drink fluoridated water and you want to drink fluoridated or rinse with mouth rinse that has fluoride in, that's your choice. But I don't promote that, and we don't promote it in our practice, and we haven't since then. So that was the beginning of the journey. And then Dr. Hal Huggins sat me down and said, "Look, I know this was a paradigm for you, but I have to do something. Canals are bad." I'm like, "What? No, not my root canals. I treat root canals different. I do a great." And so he then turned me on to the work of Dr. Weston Price, who was also a dentist. A lot of people know Weston Price for his work in nutrition. He did the Nutrition and Degenerate, get the actual name of the book, but he went around the world, looked at different primitive tribes and found that eating a natural diet from the land, they didn't have cavities, they didn't have gum disease, they had great jaw growth. So that's what most people know him about. But he did some studies which were kind of, once they were done, really weren't made public until recently, like with the Netflix series The Root Cause, which was taken down pretty quickly. What he would do, he and his son had a root canal and passed away. So he started doing this research and found that if he took those root canals out of people and implanted them under the skin of a rabbit, the rabbit would develop whatever the human had. So if they had cardiovascular issues, arthritis, whatever, the rabbit would also develop that. So he saw a clear connection in these, what we would call dead teeth or dead organs. And I couldn't accept it. I'm like, okay, there's got to be a better way. That was 1940. Here we are in the late 80s, early 90s. Like, I found this dentist in California was doing, when he had that called holistic root canals. And I said, well, that sounds interesting, because now we have available ozone and lasers. Dr. Weston Price didn't have it. So could we create a different environment inside the tooth and actually sterilize the complete thing? Then there was a test that came out by Dr. Boyd Haley from the University of Kentucky. He was a PhD in biochemistry, that you could actually test these root canals in your office. And lo and behold, even though I was using this new technique, they were all still testing toxic. So what I didn't understand from Dr. West, I had to go back and read his work. I didn't understand, even if you change the tooth, because he would actually take teeth out and sterilize them, put them back in. The problem was you would still develop infection because you haven't changed the environment or the milieu around the root canal. There's no vascular supply. So you have no red blood cells, no oxygen, no white blood cells. So you don't have your lymphocytes, your monocytes to fight infection. So that started to make sense. So then that's when I was on the new journey. But even to then, I was like, not 100%. I said, oh, God, people don't want to have their teeth taken out. So I was kind of still on the fence. And then, as in my book, you'll see when I did this, well, I didn't actually do a root canal. I did the first part of a root canal on my dad because he was in pain. The purpose was then to eventually take it out. But I had to get him out of pain. So I did what was called like a partial root canal or pulpectomy to get him pain-free. And as Dr. Hal Huggins had taught me, there's this 7-14-21-day immune cycle that can affect you. Like if something happens 7 days from, let's say you got a cold on a Monday, the following Monday, if you did something else to affect your immune system, it could have a much exponentially worse problem. And that's what happened. 14 days after I did this pulpectomy, my dad died of a heart attack. So it was pretty overwhelming. I mean, it's obviously not 100% sure that that's what happened, but I called Dr. Huggins and told him, and I was like bawling. I think I just, took my dad out. He goes, well, you can't blame yourself. We don't know. He had heart problems. And he also had sleep apnea, which then led to the book, because he was told shortly before he died in January, like in December, he had a stress test. He told me he was fine. He didn't have sleep apnea, even though he snored so badly that he had to sleep in a different room from my mom. So this, again, was started another down the rabbit hole, and realized just because snoring may be annoying, it's also as you had mentioned in the intro, leads to comorbidities. So that was so that's kind of a full circle there. And then since then, obviously, adding things like, actually going back even in the 80s, well, how does nutrition play a role in the health of the body and the health of the mouth? How are they interconnected? So what happens in the mouth can affect the body. So we know from gum disease issues, and this is not even holistic, this is traditional, that can lead to diabetes and high blood pressure. So even cardiovascular issues. So if the bacteria or microorganisms from, say, periodontal disease can cause it, why wouldn't the bacteria or microorganisms from root canals? And then to top that off, one more thing was something called cavitations, which result from the fact that teeth, when they're extracted, the sockets aren't cleaned out properly and thoroughly, so they end up being a reservoir for microorganisms, which then leak out certain toxins into the body. So it was clear to me that there was definitely a connection. So in medicine, though, it's like from here up is a part of a different body. Of course, we know that's not true. And there's a bidirectional effect. So poor nutrition obviously can cause dental issues. So it's not, and I wrote this paper in the early 90s, the cavities are not a fluoride deficiency. So it's not, it's about diet. Yes, hygiene is important. And of course, it's, I think, it overemphasized, especially because of the advertising that goes on, brainwashing people that they need to brush and floss a million times a day and use special Colgate mouth rinse or, Pepsodent. But really, and I'm not downplaying that, you do need good hygiene, but we have to look at our nutrition and see how that affects the mouth. So there is that bidirectional effect. And we know from diseases in the mouth that they can lead to systemic issues. So whether that's high blood pressure, diabetes, cardiovascular issues, but this is the most overlooked part of the body, I believe. I'm a little biased, obviously, but we don't think about all the insults that have occurred in your mouth, that if you did that anywhere else in your body, you wouldn't be very aware of it. So think about, and when I do talks, I ask people to raise their hand if they've ever been to the dentist, because everybody raises their hand. Then I say, how many people in here have had a knee replacement? A few hands go up. How many people have had this issue or that issue? And then I say, how many people have actually had dental treatment, whether it's an extraction, a filling, orthodontics, whatever it may be? Everybody raises their hand. So here we're taking people's mouths that have some kind of malady, whether it's a cavity or gum disease, and we're plugging amalgam into teeth. We're taking teeth out. We're not looking at, as Weston Price did, why do these people have nice wide jaws? Because they were breastfed and eating natural food. Once they introduced the American diet, the sad American diet, one generation, suddenly they had all these dental issues. So why is there such an increase in the orthodontics and increase in taking wisdom teeth out? Because the jaws are smaller, the teeth don't fit. We don't look at the root cause. The root cause is we need to go back to breastfeeding for minimum 18 months and giving children food that requires chewing, not these little soft packs of whatever, that gooey sweet potatoes, asparagus. They need to chew because that helps develop the jaws. So that's, I think, a pretty good synopsis. I think people can get an idea that there's definitely a connection. So hope that was helpful.
It very, very much was helpful. I know from my own personal experience, having seen the same dentist for 40 years, seeing you, and I'll be upfront, you are now my dentist, that
Thank you.
It's night and day. And when I was looking for someone who understood what I understand about nutrition, I was so surprised to find you. You not only talked about dental issues, you talked about whole body issues. And I'm like, wow, I can't even find, regular primary care physicians that talk about whole body health. So this was surprising to me. And you kind of stepped out of the status quo of what dentistry is. So it really piqued my interest. Of course, being an integrative health and nutrition coach, having you understand not only understand, but teach people about nutrition and how it affects not only just your general health, but it affects your oral health was amazing to me. But I can imagine being outside of what normal dentistry is, you met a lot of resistance that, from, the broader dental community and the medical community. I imagine they're not very happy that you don't follow their standards. How have you handled that resistance?
Well, as we said before we started, you can't stop. I mean, when you have these barriers in front of you, you have to find a way to work around them. You have to practice your truth. And that was my truth. And I said, long ago, I said, if I can't practice this way, I don't really want to practice. I'm not going to go back to plugging amalgams and doing fluoride treatments and root canals. I just refuse to do that. And fortunately, I was able to at least identify some groups out there, the International Academy of Oral Medicine and Toxicology, the Holistic Dental Association, and the International Academy of Biological Medicine and Dentistry. So I was able to find a community, still very small compared to the 150,000 dentists that are in the United States. So out of that 150,000, maybe 1%. Now, that's back in the late 80s or 90s. It's grown probably maybe, it could be 10 or 15%, but that's still a small number. So I was not really able to feel comfortable going to the local dental society meetings or the American Dental Association annual meetings or the Maryland State Association meetings, because they were talking the same stuff again, and I didn't want to really listen to that. And I wasn't really welcomed, let's say. But I had to persevere and keep moving forward. It didn't really have an option because that's what my belief system is. And I think this is true for everyone. You have to follow your truth. And if you don't, then you're succumbing to other people's truths. And that's not ever good for you, whatever your health decisions are or any decisions in your life. And I know your podcast is all about sovereignty. So we have to establish that. So whether it's health sovereignty, oral health sovereignty, not getting being mandated to take vaccines, whatever, it should be your choice. So the same thing, when I talk about these things, I don't twist people's arm like you need to get this root canal. I'm here about educating you what I know, because you're not going to get that somewhere else. Now, you can go to your past dentist, compare notes, make a decision. You can even go to Dr. Google and figure out what your truth is, because you
I don't
have to make
suggest
that
it. Let's
decision.
just put it that way. I don't suggest Dr. Google.
Yeah. Yeah, no, I don't either. And that's become, the internet has become somewhat of an issue, because you can find out anything to support your belief system.
On either
But
side.
as you found out, and in what you do, there are a lot of chronically ill people. They're not getting better, because of what they're releasing in the atmosphere, what they're putting in our food, poisoning our water. So you have to make some positive choices. And if you don't, you're going to have to succumb to, some kind of life with prescriptions, or slowly, not even slowly, sometimes quickly dying. So we've seen, the morbidity rate going up. We know that something's going on. So I'm not here to profess all those medical issues. I'm because I know you do that anyway. I just really want to make it clear that please consider, if you have some chronic health issues, think about seeing a biological dentist. Ask him the questions about your mouth. What's in there that could be possibly keeping me sick? Because even integrative, holistic, complementary physicians, functional medicine doctors, they're not all aware of it.
You're absolutely true, because what you said before, above here, it does seems to be outside of the purview of many doctors. I mean, I've talked about before on my podcast about going through glaucoma, where emergency room doctors know nothing about the eyes. It seems they wouldn't look at it, kind of ignored it, and did all the other standard tests and never really addressed it until I lost my eyesight. So I find that the truth about what you said for your teeth follows along the same lines, because I know various dentists who they still defend root canals, the fluorides, the amalgam fillings, and everything. But I feel like there's something missing here. They have blind spots. And my concern is it's not just about their training. Yes, you're all trained in a certain way. You have the opportunity to learn other things such as you have. And I must say, if you see Dr. Sam's wall of how much he has learned and how much he's implemented his learning into his practice, you will be amazed. But I think the blind spots are really the fact that many of them are taking insurance. Do you feel that's part of it?
Well, they certainly control the industry. We know they do in medicine, but also dentistry, because sometimes patients, and I see less and less of those people because people do seek me out for what we do. But occasionally somebody says, "Oh, do you take my insurance?" Or, "I know I should probably do this, but my insurance won't pay for that." Um, well, that's an open door for me. Like, okay, let's have a little discussion. Do you really think your insurance cares about you being healthy? What do you think the system is? Is it a healthcare system or a sick care system? It is all promoted by keeping you sick because there's so much more money in keeping you sick than keeping you healthy. And you're giving up your sovereignty, right? By someone else telling you what you can do and can't do. And when you talk about medical testing, I mean, most of these tests, although functional medicine doctors are better than traditional, but they're still missing the piece because they'll look at the test and say, "Oh, everything looks perfectly normal." But you go, "Well, wait a minute. I have brain fog. I'm fatigued. I can't sleep. I have digestive issues. I'm bloating. Oh, but all your tests look fine." So, and if they don't, even functional medicine doctors will still write prescriptions. So, what about using some natural, herbs or Ayurvedic medicine or supplements that might make a difference? So we're kind of all brainwashed. But going back to your question, but the insurance system and the pharmaceutical companies and the AMA and the medical schools regulate that. So when we're seeing more and more of that come out now with our new Secretary of Health and Human Services, digging deep into that, like, why are these medical schools being taught these things? Well, who funds the medical school? The pharmaceutical companies. And I'm not here to downplay the pharmaceutical companies. I think they
It all goes
have a
back to the
place. There
Rockefeller
are times
medicine.
when, right, yeah, let's get rid of homeopathy. Let's make everything, petroleum based, because that just helps our bottom line to our stockholders. So again, that's a story that I think people should investigate, because people are always, well, what are they, people evil? Why would they do that? I don't understand. So you have to do your own research and figure out why, and decide if that's in your best interest. Because the bottom line, if you're on a medication and they're starting kids, very young on these medications, like for ADHD, and they're going to be on it for the rest of their life. What's the quality of their life going to be? And then, so you have that part of it, but then they're also going to the dentist and having teeth extracted or root canals done and mercury put in. It just adds to the toxicity of an already toxic environment, already toxic body. The pharmaceutical companies, or pharmaceuticals, I should say, are taking our body away from its natural healing process. So, and I find it interesting. I had a patient come in, and she was having some knee issues. I know she went to the orthopedist. I can't remember precisely whether she had a knee replacement or some kind of knee surgery. But on one of her follow-up appointments, she told the orthopedist that she was having problems with her elbow. And she was told, "I'm sorry, I don't treat upper appendages." You're talking about compartmentalized medicine. This is just crazy. So what would you think they would say if, I have a sore in my mouth? And I can think back when I did my hospital residency, we were on call, and I remember one night being called down to the emergency room because one of the physicians said, "I have a patient in here, I believe has oral cancer." So I said, "Okay, well, let's go. I'll go down. I'll look at it." Well, it turned out it was an apnea ulcer, or mouth sore. It was cancer. So they really have very limited knowledge of what's going on in the mouth. he saw sore or also thought automatically it was oral cancer, which was fine. I think it was important that he didn't just ignore it and got some expertise. But
Or
my
he
point
didn't
is that they
treat
don't
it,
really know much about the mouth.
right, or he doesn't
Right.
treat it
Yeah.
as he
Okay.
would
We need now.
anything else.
Right. Okay. It's oral cancer. Let's send you to the oncologist. Let's biopsy it. And so, um,
Hmm.
so I think patients really need to educate themselves about whole body health, but don't leave the mouth out of that. And we didn't even talk about, you know, the TMJ, the joint of how we're opening, closing, we're losing teeth. It throws our bite off. That can affect your neck. It can cause neck and shoulder issues, lower back issues. Same thing. If someone has a knee problem, we're just going to have knee surgery. Well, what about where maybe their posture's off? Maybe they're pronating their foot. Maybe they have high arches. Maybe they have lower back issues that's causing the knee problem. They're not getting to the root thing. We need to really address the root cause in any of this. So dentistry is no different, whether it's a dentist, medicine, ophthalmologist, podiatrist. We all need to look at the whole body. We cannot compartmentalize that.
That is absolutely true. When you talk about healing holistically, it is about healing the whole person. That's what holistically is all about. You treat the person as a whole being, not a, components of different pieces and parts of the body, which is what medicine has done. It has compartmentalized everything. You are a symptom at this part of the body that I can only treat, like you said about the doctor with the knee, can't treat the elbow. It doesn't make any sense because what I view back in like the 1850s when we were talking about homeopathy, being the primary care for people, they did treat people holistically. They looked at the whole person and what was happening and found a natural solution. And that's where I'd like to go with health, thinking we need to get out of allopathic medicine in every field, go back to natural medicine and stop calling natural medicine alternative. The allopathic medicine is the alternative to natural medicine. We've got it twisted and we always do. And I think this is so important for somebody like you in just from your last explanation using the power of biological dentistry, you don't admit, you don't take an exception to something else downstream having a cause or an effect from something that is dental. And I think that's really important for not just dentistry, but for every aspect of medicine.
Yeah, it's a good point. And just to bring up, and I know you're aware of this, in Chinese medicine, it used to be if you could not keep your patient healthy, you didn't get paid. So we do just the opposite. So what if that was the new paradigm? Okay, doctor, and until you get this patient well, you don't get paid. Boy, would that be
That would
different.
completely disrupt the industry, and they're not going to do it. There has to be some sort of slow different, differentiation of how medicine works. And I give props to Secretary Kennedy to starting the process, but I'm going to hold my judgment until I see some actual change. A lot of talk, not a lot of action. I don't really
Yeah.
care about the dyes in food when I'm being chemically sprayed. And like you said in the beginning, I didn't give my permission. I have no consent to be part of this experiment. I don't want to be part of it. I want to have bodily autonomy, and I can't do it if they're making choices for me that I can't opt out. How can I opt out when they put stuff in my water? Well, I can choose not to drink the water. I can find ways of filtering it. If they put in the food, well, I can find ways of opting out. I can grow my own food or find a farmer that does it organically without chemicals or pesticides. But I can't do it about the air. I walk outside, I'm exposed to it. And that has a downstream effect, I think, in every aspect of your life. And I think it's probably true even in dentistry. Maybe there's, from whatever's going on, could be metal particles of some sort, could cause dental issues too. But nobody's looking at it because they think these days this is normal. How do we get back to stop what is people think are normal to what really is supposed to be. We're biological beings. We're actually spiritual beings in a biological suit here. But how do we get back to that? How do we focus on how you are doing your practice? How do we get those in the industry of who are supposed to be helping people to help them? I like your idea of going back to the Chinese medicine. If you only get paid to, if you heal your patient, but how do we make change in the meantime?
Yeah, that's, I think, the $1 million question that I don't think you and I are going to be able to solve that. So I
I
think it
like
really
asking
comes
those
down to
questions.
personal. Huh? I think it's personal autonomy and sovereignty. You got to make those choices because they're making negative choices in your health. And like you said, what are you going to do? Like, you want to not breathe the air? Do you walk around with some kind of mask? And I'm not talking about these paper masks they had during COVID. I'm talking about like a mask with a filter on it, so you're not breathing whatever they're spraying in the air.
You actually need a respirator.
Obviously, yes, like a respirator or an oxygen tank. I mean, that's a little. I mean, that's. But then again, we're going beyond how do you live in that kind of atmosphere. I use that play on word atmosphere, but there's only so much we can do, and and the thing is, I tell patients, look, if we didn't have to deal with all this other toxicity, a root canal or a mercury filling may not be an issue. Maybe your body's strong enough, has enough resiliency, even though they're bad and they're toxic, that your body can handle it. The body was designed perfectly to detox under these circumstances. The problem is, and I hear this in, oh, we have a liver that's supposed to detox. The liver is so toxic, it can't work anymore. So we have to do these positive things. People say, oh, well, how long do I need to detox? I said, forever. You don't stop, because unless you find some type of utopia where you can isolate from all these things, even, I talk to people who are vegetarian. Well, I'm not going to eat, meat anymore. I said, but do you know those plants you're eating are sprayed? Glyphosate, we know that's a toxin. And you add that to all the other things, the water, the air, how about the 5G, the EMFs, all these things. And I want to make a point, because there's a lot of myths. Well, I have mercury in, or I have metal. We don't recommend any metal, even gold, because, and I learned this from Paracelsus, Dr. Thomas Rao, you are a walking human antenna if you have any metal in your mouth. So even though gold is not considered toxic, but gold crowns have palladium and platinum in it, but it's just metal. So we recommend no metal. So it's not just the mercury. And the other thing, people will say, well, I know I can heal myself from whatever ailment, even cancer. Why can't I heal myself from this root canal? Well, the problem is, when, let's say, you have cancer, you have an increased supply of blood to that tissue, diseased tissue. You don't have that with a root canal. You have no blood supply, so you have no way to heal that. Because in this realm of holistic, we do get patients who are, they do want to heal things. They want to heal things themselves. So, I'm going to use some clove oil. I'm going to use some kind of essential oil to heal this root canal, and it's just not going to happen. You can keep it at bay, and if you don't want it out, what I recommend is you have to do everything you can possibly do to keep your body as healthy and resilient as possible. And we have a lot of things that are going against us. I mean, are we testing your genes? What your genes are different than mine, so what your ability to resist something is going to be different than mine. We're all individuals, biochemically, bioindividuality, emotionally, spiritually. You got into that piece. I mean, yes, we're spiritual beings. We're energetic beings. We're not even looking at that. I mean, energy medicine's been around for 30 years. Well, it's been thousands of years. But I mean, really, in this country, when Dr. Becker started talking about energy and how it affects, we are energy, and we're more electrical than we are chemical. But the pharmaceutical companies want us to be more chemical, which just disrupts the whole electrical system. So how about if we can create a system that, if we could eliminate all the toxins, put ourselves into a state where we actually use that innate ability to heal itself? That would be ideal. And I think everyone has the power to do that. So then whatever they're going to throw at us, we have some kind of defense.
I totally agree with that. And just touching on what you said, even though I agree, we are spiritual, electrical energy beings created perfectly by God. I totally believe that. And what I can't understand is how people have bought into the fact that we need some sort of synthetic chemical to make us better. Our bodies don't process chemicals, they process nutrients. So you're not deficient in Prozac, you're deficient usually in some sort of, trace mineral or vitamin or something to get you back to where you need to be. But people have bought into this. You need these, pharmaceuticals, like you said, these are petroleum products, and the goal is not to make you healthy. The goal is to keep you a customer. So if you're looking into the future, I think your practice is one of the very few I've ever heard of that is truly holistic, because you go beyond just dental. You have totally transformed the world of dental profession. What would you like to see, or what's your vision of what the dental profession would look like in the future, whether it's, near future or 10, 15 years down the road?
Well, I think what's most important is, again, get to the root issue. Like, what is your nutrition? What are you being exposed to? Why, if you are having dental issues like cavities or your teeth are dying that require, what's causing that? So let's get back to those basics. Let's get to the root cause. I mean, we may have to deal with the current issue because it's in an emergency situation, or you're in pain, or we don't want that infection going to your brain. But we really need to get back to the basic of what are you surrounding yourself with? What created this periodontal disease? What created this cavity? What created this abscess tooth? Instead of just treating it, we should not be mechanics. We're taught very well to be excellent mechanics. Do that root canal perfect, put that crown, that filling, everything is in the, we're working in the millimeters of accuracy. So we can be although some are not very mechanically good, but that's another story. But we can, for the most part, we're taught that very well. So there's no reason not to be. The problem is we're not taught. And it's interesting because for the first 2 years, we're taking anatomy, physiology, biochemistry, all these same courses that medicine medical school teaches. But then we kind of forget about, in year 3, we start treating patients. Now we become these great mechanics. So let's fix the teeth, save the teeth, and no matter what effect it has on the body. So I think getting back to that basic principle, like what's causing it. And then the second part of that, how can we prevent that going forward so that you don't have a lifelong, dentistry is not inexpensive. Insurance is horrible. It doesn't pay much. Do you really want to be a dental patient forever? Do you want to keep coming in, having the same thing done over and over again? Because patients will ask me, I don't understand how I got a cavity. I said, well, let's talk about your nutrition. So, and you mentioned it, like these foods that we're taking, not only are they not nutritious, they deplete and they cause, gut microbiome issues. So you can be taking hundreds or thousands of supplements, say, oh, I'm doing this and that, but you're not absorbing them. You're kind of wasting your money. So let's get to the bottom line. Let's do some testing. There's some basic tests. Like we do things like we checking for heavy metals. We're looking for mineral deficiencies, vitamin deficiencies. We're looking at heart rate variability. Like, what is your stress level? Like, your parasympathetic system's not working. You're in fight or flight all the time. Your body can't heal. You can't sleep. You're in fight or flight. What's causing the stress? Oh, I'm just stressed out because I had to move, or I'm having a hard time at work. That adds to it physiologically. Your body's stressed because you're not eating whole food. That's stressing your body out. And because it's not nourishing you, what do? You eat more. Look at the obesity problem in this country. It's out of control. Growing up in the 50s, 60s, I only knew one kid who was a little bit overweight. I don't know the word obesity was around. So I didn't know anybody had autism. Well, I guess ADHD, we call it just hyperactivity. Most boys, we're just being boys. So, so it's crazy. So, in answer to your question, I think people just need to educate themselves, listen to podcasts like yours, listen to my daughter's podcast, the Biohacker Babes, giving you
I want to
basic
have them
information so
on.
you can make some. Yeah, I think that would be great.
Yeah.
Just having some basic information so you can make and be autonomous and make positive decisions for yourself. And the thing is this cognitive dissonance. So we hear what we want to hear and we support it with facts. I mean, you hear this story all the time. Well, I get holistic patients coming. So how's your family doing? They don't believe anything I do. They think I'm wacky. They think I'm off the wagon. They have bought so much into the medical because they believe that medicine is doing the right thing. We're here to help you. Turn off your TV, cut out those commercials. It's the most ridiculous thing in the world when I see people taking whatever, Ozempic, and they're dancing around like life is just great. Go work out, change your diet. So that's what needs to be stressed. And I think we can start that even with at the dental office.
Totally agree. And I think you live what you preach, and I and practice. So you're constantly caring and finding other ways to care, not only for yourself and your patients, but what would you recommend for people to be like a daily routine? Or, if you feel so called to share your daily routine that gives people an idea of what you need to be truly healthy.
Yeah, that's always a question I ask myself as we deal with things, because there's not a time in your life where you might not feel the best, whether you got a cold or the flu or you got COVID or something's come. But then
I don't even go there.
yeah, but what are you doing in a positive manner to, one, deal with that, and two, prevent it? So yes, I do make conscious decisions on a daily basis, hourly basis. Like, what am I going to do to help myself? I'm going to be 72 in 2 weeks. I'm
And
still
you'd never
working out.
know it. I mean, I've met this man in person. You would never know it. He has more energy and he looks great and he's incredibly fit. Just going to throw that in there.
And I'm still working on that. I look at myself and go, I can be even fitter. I can have more energy. I can, and it kind of drives some of my staff, like when I come in the morning, why do you have so much energy? And I'm like, why don't you? You should. And you probably slept more than I did. So so part of that too is having a positive attitude, having some purpose in life, and making these things available. And, I first have access to, as you've been to our performance and longevity center, and also in my home, I have things that people may not be able to afford or have access to. So you do have access to the sun. You do have access to grounding. So you can take advantage of that. You do have access to whatever meditation you want to use to reduce your stress. These things don't cost anything. You don't have to spend hundreds of thousands of dollars. Now, if you want to go to the next level, you can start to introduce things like red light there, and you can buy red light panels at a pretty low cost. Um, Hyperbaric oxygen tanks have now become available. People are putting them in their homes. It's still a little bit costly. It's going to probably at least maybe 8,000 to start. But that has hyperbaric oxygen. You can find places that are doing lymphatic flow. I mean, there's great practitioners out there. There's Reiki masters. There's massage therapists, good chiropractors who are doing really healthy things. Craniosacral therapists. So you can find these people without spending a lot of money, but do the basics. Go out every morning, get that morning sun, walk in the grass barefooted, go to the ocean if you can, go to the mountains if you can. Doesn't cost anything, but you have to make a commitment. And unfortunately, I find people, and we're all humans, including myself, we are easily sidetracked and we can easily make excuses. I'm too busy. I don't have time to work out. I don't have time to eat well, so I go to the fast food line. or I go to the, drive-in. Those are just excuses. So, and I remember studying under Dr. Marshall, who has since passed away, unfortunately, the CEO and starter of the supplement company Premier Research. And he said, when you're traveling, for example, when you're in the airport, says you're better off not eating anything than eating that garbage. So if you're hungry and you feel like, oh, I got to get in line at McDonald's to fill my stomach, don't do it. You won't die. I promise. You can fast for weeks and not die. So, especially if you're overweight or obese, you got plenty of storage there. So make those positive things. Take away the excuses. Kind of go off on your own if you have to. Find a community that can support you in that way. Get away from the negative people. Get away from those people who are constantly telling you that you need to take drugs or you need to follow the doctor's orders. And I'm not here to refute doctor's orders. Sometimes they're good because there are some good medical people out there. But stay away from the ones who just want to write prescriptions and don't want to do anything else. Take control. And that's what your podcast, have your sovereignty in every aspect of your life. So that's how I come in, and I do like to walk the walk. I'm not going to sit here and tell people you should do this or that when I'm taking a bunch of drugs, I'm not working out, I'm not sleeping. I have to do these things for my own benefit, but also I can't talk to people about that if I'm not doing it. I mean, that's hypocritical. It's like the old doctor in the past, hopefully they'll still do it, telling you about your blood pressure while they're sitting there smoking a cigarette. Of course, in the 60s, they were pushing that for stress reduction, blood pressure reduction. So just think about how we have been smoke and mirrors for so long. And then we find out years later, this is not the truth. So this stuff is still going on. So you'll find out, but don't wait 10 or 20 years to find out the truth. Dig in. And as you said, don't rely on Dr. Google, though. Please reach out to people that are really knowledgeable.
Yeah, I think people need to reestablish the connection with themselves. I think they're so disconnected because they're living a life of convenience. They work hard, they've got so many things to do, and it's like you're saying, you're in the airport and you're hungry. Well, I always say rethink these things. Don't conveniently go to a fast food. Prepare before you go. Have something in your bag that you made or you know is clean and you can eat when you are hungry rather than just, saying, I don't have time. You make the time for everything you do. So make the time to do things that are good for you. That's really the thing that I emphasize most. You're in total control. You've just given it up. You've given up your sovereignty, and many times you give up your bodily autonomy to the doctors, to whomever tells you must do this. And you, instead of saying, let me think about it, you don't even have to say no first. You just say, let me think about it. Then make a decision after you get all the facts. But most people don't do that. They just accept it's like the white coat syndrome. You know more than me. No, you don't. You know your own body better than anybody else. Now, I frankly didn't know a whole lot about dentistry, and I admitted that to you when I first saw you, and I'm like, wow, this is completely different than what I thought. But it makes so much sense coming from my own background, how it's all integrated. It's not, your teeth aren't just one little thing. They're part of the whole you, part of your skeletal system. So you need to be able to reconnect with yourself and make that judgment that the body as a whole. So if one thing isn't working, maybe that other thing that isn't working is related, and start putting the pieces together.
Yeah.
So one thing I wanted to
with
touch
that
on.
point in mind,
Go ahead.
we didn't touch on the meridians and how every tooth is connected to an organ or other structures in the body. So we talk about this energy connection. So, for example, wisdom teeth, which are taken out very easily these days. Let's just get them out. You're going to college. We got to take them out. We don't want you to have a problem while you're at school. They are on the cardiovascular heart meridian. So you are affecting that system. And for example, upper first molar, 6-year molars are on the breast meridian. So if you have a root canal in there, what's the connection? but they don't consider there's a connection because the mouth is separate, right? It doesn't connect to any other, and that's just the energetic. Then we're talking about the systemic connection, and look at the jaw itself is innervated by the trigeminal nerve, the largest cranial nerve. So you can have these infections go along the nerve or close to the brain. It's the first part of the digestive system. So just start to put all those pieces together. It'll make a lot more sense. So make some of the, because there's some things for most people, they may not have these other degenerative things. Most of it's going on in the mouth because they have, whatever reason, early intervention by the dentist. I had 14 amalgams placed in my mouth. I wonder if I really needed them. I didn't know. So, of course, I had them taken out as soon as I found out how dangerous they were. But I also didn't have a choice. You know, I didn't, as a child, they didn't say, oh, would you like to have something else placed in there? No, there wasn't a choice. And I remember even to this day, putting those things in and spitting out in this bowl, this black tarry stuff, which I didn't know at the time was just the residual mercury. How much of that did I swallow? How much of that went to my brain? So how much of that can I attribute to any issues I had? I had some sensitivities like allergies to grass and things like that. Did that make my body more sensitive because I had mercury poisoning? Possibly.
Yeah. I mean, there's so much packed in here. We could probably talk for days, but before we stop, I do want to touch on your book a little bit, Stop the Snore, because I think it frames snoring as more than a nuisance. It's a warning sign. And so I want to give people, an opportunity to hear from you. What should they know about that connection between snoring and their health?
Yeah, snoring, as you said, for most people is a nuisance. We think about Uncle Joe after Thanksgiving dinner, goes into the other room, he's in the lounge chair and he's snoring, right? And everyone's laughing about how, but also then, I hear couples come in and say, my husband has to sleep in the other room because he snores so loud, it kind of vibrates the house, And the fact is 35% or so of married couples don't sleep in the same room for that reason. So snoring is not just a nuisance because the decibels that are involved are pretty high and annoying to the other partner. So then the person snoring, they think they're sleeping well. The person next to them is not sleeping because of the snoring, but it's more than that. Snoring is the initial signs of sleep apnea. If you're snoring, it means the tongue is partially obstructing the airway. This causes drying out of the back of the throat, ultimately will, if not already, lead to sleep apnea. Sleep apnea means you actually stop breathing while you're sleeping. So you're getting less oxygen to the body. And that's why there's this list of comorbidities, because you're in a hypoxic state. And the worst time ever, because that's when the body's repairing itself when you're sleeping. How well can it sleep if it's not getting oxygen? And the thing people don't realize also, this affects you during the day. You're not getting good oxygen even during the day. You might, I climb up these stairs and I feel out of breath because your airway is partially compromised. You just don't notice it when you're in a standing position because you have these receptor sites that accommodate for it. You lose all that when you're asleep and you're in a horizontal position. So, and there are things you can do. The gold standard is CPAP, which most people don't want to wear it. About 30% will wear it, but the rest won't. So there's dental intervention. So that's where we come in. So there are appliances you can wear. There's also devices that because most of the time root cause is a narrow jaw, meaning there's not enough room for the tongue in its forward comfortable position. So where does it naturally go? Back of the throat. And then when you lay your head back, what happens? The tongue further aggravates the back of the throat, causing either snoring or complete apnea. So we have to pay attention to this. And I have patients, even I tell them, like, we do a sleep study, or this is great to do this at home. But, Angela, it's crazy. Even when you educate them, sometimes they don't want to do this. And I don't like to be a fear-mongering practitioner. I like to present information. people still have to make positive decisions. So I've been told sleeping, they're not the consequence of those comorbidities: stroke, heart attack, diabetes. I would consider those comorbidities. And that's our conversation here. If you add all that, so in regards to snoring, obviously it's a serious health issue. You can do it rather than awesome to your partner, but it can lead to sleep apnea if you don't already have that. That can lead to all these comorbidities. And the interesting thing is, if you're not sleeping, besides not resting and healing, you are going to have these hormones between ghrelin and leptin, which then comes the hunger hormone. You're going to want to eat more, and you eat more. When you gain weight, that affects your airway even more, and also leads to these other comorbidities. So don't take it for granted. If you've been told that you're snoring, please either reach out to a biological dentist that addresses these things, or your physician, but don't let them stick you with just a CPAP. There are alternatives.
Well, thank you for that, Doctor. I would like just to wrap this up, give you an opportunity to tell everybody where they can find you, what you want to share with them, how to get in touch with you.
Yes, so I've been pretty much in the same place. I made that transition 30 years ago, 38 years ago. I'm in Ellicott City, Maryland. Some people may have known Columbia, Maryland. It's kind of the same. They're kind of right next to each other. I'm in a office that can provide these kind of services. I'm not in a shopping center. So we try to make the center, pretty homey. So when you walk in, you feel like you're at home and comfortable. And yes, I can be reached. That's in Ellicott City. You can go to the site juliandentist.com to get information. You can find me on Instagram. And I just want to say, as I talked before, I do have people coming from all over the country. Before I got on this podcast, I did a surgical follow-up with a patient that I saw yesterday who then got in the car driving 4.5 to 5 hours. We get patients from even out of the country. So once people realize how important this is, they will travel. So excuses, they have taken away excuses for themselves to do whatever it takes to get well. So thanks again for me to speak my truth. Thanks for what you're doing. I think it's empowering from what you're doing to let people really get and make decisions that are positive for your health and your family.
Well, I want to thank you, Dr. Sam, for coming on. I hope you'll come back, and I hope we can follow up with more information. You're a wealth of wonderful information that I think more people need to hear. And I want to thank everybody for joining us. And hopefully you'll come back to the next Sovereign Sisters podcast. And until then, be well and God bless.